Hello everyone, I'm Nazman Nahar from Community Health Biology. Today we will talk about acute cholecystitis disease. I'm sorry, I have difficulty pronouncing this word. Some objective of acute cholecystitis disease are understand the basic of acute cholecystitis disease. Identify some common signs and symptoms. Have some basic knowledge about acute cholecystitis disease and how risk factors. Know how to reduce this disease or how to not have this disease. So today we will talk about the definition of acute cholecystitis, basic sign and symptom with different figure and description. We will talk about causes and the prevention. We will talk about some risk factor and diagnosis, and end of the presentation we will talk about how to treat this disease, how we cannot have this disease, or if we have it, how we can prevent it. So what is acute cholecystitis? There is two kinds of cholecystitis. Cholecystitis is the inflammation of gallbladder. Two kinds of cholecystitis is acute and the chronic. Chronic is the lower level of inflammations, and acute is a sudden gallbladder inflammations. It it's usually resulting from the infections of a stone in the cytic gland. Cytic gland is the main opening of the gallbladder. About 10 to 20% of Americans have gallstones. Almost 95 patients with the acute cholecystitis has chlorolithiasis. Women have a higher risk of developing acute cholecystitis. Here is the picture with the gallbladder that affect with the acute cholecystitis, and the bottom part of the picture shows complication of acute cholecystitis. Sign and symptoms. Usually after a high protein fat meal or large meal, the sign and symptom of acute cholecystitis infection occur. Most common is the abdominal pain. Abdominal pain is like pain in the upper right region of abdominal. Patient when patient has the abdominal pain, he or she cannot sit comfortably. They have difficulty sitting. The pain lasts for several hours. Abdominal pain can spread to the right shoulder or back. And some other signs and symptoms are fever, nausea, vomiting, sweating, seals, abdominal bloating, clay color stool. Nausea and vomiting are two most common symptoms. They often show up after a patient eaten big or especially fatty meal. The picture shows different kind of symptom with this disease. Let's talk about causes and prevention of acute cholecystitis disease. Some causes. Blood stones are the most common causes of acute cholecystitis. Can also be causes by several illness or tumor. Tumor block the bile fat. A growth in your pancreas or liver can stop it from drying. Bile duct blockage and blood vessel problem. Blood vessel when decreased blood flow to the gallbladder lead to a cholecystitis disease. Some preventions. Best way to reduce the risk of developing acute cholecystitis is to have a healthier diet. Try to maintain healthy weight. Balance the calorie intake. Of course, exercise regularly. Avoid food that are high in fat and cholesterol. Some risk factor and the diagnosis of this disease. The risk factor of the gallstone higher in obese people. Anyone older than age of 60. People with a rapid weight loss. Women are higher risk than men. People who eat high fat protein. This graph shows the effect of gender over the inequality of acute cholecystitis complications. The red one is the non-complications and the blue one is the complications, which shows both men and women has higher in non-complication cholecystitis and the diagnosis of acute cholecystitis are mostly doctor provide different kind of blood tests, which like amylase or lipase, complete blood counts, and then for image test image test is to show the gallbladder, abdominal ultrasounds, abdominal X-ray, a scan that shows the movement of the bile through the body. Those are the some diagnoses of the acute cholecystitis disease. Treatment of this disease. Patient who has acute cholecystitis disease most likely require hospitalized. Have to keep the stomach empty. It is just because the gallbladder need to take rest, I guess. Most of the time, patient get patient has to get fluid through the tube that inject in the vein, so that they get they don't get hungry. Provide antibiotic for infections in the gallbladder. Pain medicine to relieve abdominal pain or all other different pain that patients suffer, and the surgery is the most surgery to doctor sometimes suggests to surgery to remove the gallbladders. Finally, the summary of my presentations. Um, after viewing the presentations, try to answer those questions. What is the acute cholecystitis? What are the some signs and symptoms of this disease? What are the possible causes and the prevention of acute cholecystitis? what are the some risk factor and diagnosis of acute cholecystitis disease, and then explain some possible treatment of acute cholecystitis disease. So finally, this is the bibliography page where I get the those information from. So if you guys want to know more about acute cholecystitis disease, you may search those link, and hopefully you will get some more information about it. I just provide some basic knowledge like what is the disease, what the acute cholecystitis disease is, how it, some causes, and how we can prevent those, some treatment, some basic knowledge of acute cholecystitis. But if you want to know about the detail, I suggest to go on those links. And yeah, thank you for being with me.